begin with a health alert from the Cuyahoga County Medical Examiner. 6 people died from drug overdoses just yesterday, 10 since Sunday.
Those victims range in age from 31 to 69. Most are in their 50s and their 60s, men and women from 6 different communities.
The medical examiner believes the overdoses cluster is likely linked to fentanyl and possibly carfentanil. It's days like these when it's evident the opioid epidemic still has a strong hold on Ohio.
As the death toll continues to climb, those on the front lines of this crisis are mobilizing to strengthen efforts to help turn the tide. News 5's Mike Brookbank is here with us now. Mike, this latest warning from the coroner comes as we get this partnership now to better tackle the problem as a whole.
Yeah, Rob and Danita, as our community continues to struggle with addiction and overdose deaths, a local university is stepping up its efforts to help. The move expected to help save lives in Northeast Ohio. Case Western Reserve University intensifying training efforts for students in its nursing and social work programs.
We know this is a critical issue in our community.
In light of the opioid epidemic in Northeast Ohio.
Resources are an issue for treatment.
A $1.1 million grant funding a new program that will strengthen the safety net for those struggling with addiction.
We have a real opportunity here.
Over the next 3 years, students from CASE will partner with professionals at 5 community organizations, all of them on the front line of substance abuse.
To really effectively treat opioid use and substance use disorders in this community.
New Directions in Beechwood.
Well, it is a frontline problem.
One of the treatment centers that will be training the future nurses and social workers.
Knowing what clients are going to be best to respond to is going to make a big difference.
CEO Mike Mattoni tells me that focused treatment will prevent clients from relapsing.
They can get connected right away to the right kind of help. It's been shown over and over again. They're more than likely not to see them, rotate back through again.
So the more students that we're able to train in this area and effectively train, the better the outcomes will be.
The goal, create a long-term workforce pipeline of practitioners that will stay in Northeast Ohio.
Over time, I'm hoping that as we put out more qualified practitioners and interdisciplinary practitioners to really holistically treat these issues with children, with families and adults, it will change the fabric of our community and the outcomes in the long run.
Last year, the overdose death rate in Cuyahoga County was almost 3 times the national average. It is one of the catalysts for CASE to take its training to the next level.
Well, Mike, we do know that this effort will be far-reaching.
Yeah, all 5 organizations treat a cross-section of the community to different ages, different ethnicities. It will really give these students an opportunity to see how this problem affects all those different people and the best options and treatment for them as well.
All right.
Mike, thank you.